94.3 The Point. It's the Jersey Shore's hit music channel. It's 8:09. Lou and Liz.
Chance of a passing shower, even a thunderstorm today. Otherwise, clouds and some sun. High 72.
It is not bad this morning. It's 61, and we have some pretty clear skies. You know, we've teamed up with Meridian this week, and we've been paying tribute to some incredible EMS workers, really true heroes in our area. And you know, we've been talking about some of the heroes throughout this week, including Chuck and Richard and Bob and Katie and Kevin. And we have several of the heroes here with us this morning, and we think it's great that you guys could stop by because this really is it really is your week, and it's for you. We're going to start with Katie Forsora. Katie, how are you?
I'm doing great, thanks.
Tell everybody about what it is that you do.
Well, currently this year, I'm the vice president of our first aid squad in Fairhaven, New Jersey. And last year, I was the captain of the squad. Have been on the squad since 2002. And everybody on the squad does a lot. Every time I hear the word hero, I have to smile because behind everybody here would agree. Behind each of us, there's a whole squad that's doing a lot of work. And pretty much everybody's a hero on that squad.
Really,
the way I see it.
It's a real true team effort, too, right?
It really is. Like right now, there's people in Fairhaven cleaning the rigs. They're stocking the rigs. They're probably responding to a call, perhaps even as we speak right now.
Yeah, it must be.
So let's say thanks to them if they're listening, hopefully.
Of course.
Thank you for all your hard work.
Must be incredibly satisfying work.
It's very rewarding indeed.
That's fantastic. Anybody you want to say hello to? Any family, friends?
Well, I'd like to do a shout out to my pal Kim Ambrose, who I think snuck that nomination in. She's working at the fort today as a dispatcher. So thank you, Kim. She was also a captain in the Little Silver Squad. And shout out to the officers who I think are working hard today, Bob Kruger and Joe Truex and Trudy Wojciechowski.
Well, we're so glad that you could be part of the celebration today. And I know it's great that you represent so many people, and they're all heroes, and we want to acknowledge everyone. But thank you so much for all that it is that you do.
Thank you.
All right, and we bring in Kevin Toomey, right? Kevin, how are you?
I'm good. How are you?
Good. So what got you involved in all this?
I would say my family got me involved because when I was younger, I was very, very sick, and I had epilepsy. So the EMS always came to my house and took me to the hospital.
Wow.
And my sister actually pushed me to get involved into EMS. So
it must be amazing having been on both sides of it, as you get to someone's house knowing that they're feeling about you the way you felt about those EMS workers. You couldn't wait to get in the door, right?
It's amazing. It really is. When I see somebody having a seizure, I think about the times when I was younger that it couldn't be controlled, and now I can help them and say, okay, I can help you. It is amazing.
Well, you've gone from having heroes help you to being the hero that does the helping.
Yes.
That really is awesome. Well, congratulations to you on this honor. Anybody you want to say hello to?
I want to shout out to my mom and my dad. They're both listening.
And they're inspiration
Hi, Mom and Dad.
for you, right? Isn't that great? That's fabulous. Well, listen, for you also, thank you so much for all you and your coworkers do, and the fact that it means so much to you and so close to your heart.
Thank you.
All right, and let's bring Richard up. Richard Huff.
Hey there. Thanks for having us.
Oh, listen, it's our pleasure. Thanks for being here. So tell us about your story, Richard.
Well, I'm the chief of the Atlantic Highlands First Aid Squad, an all-volunteer squad in Atlantic Highlands, New Jersey. Great group of guys. This hero, as Katie pointed out, it's not just me. It's a whole bunch of folks, men and women, who get up 24/7 and answer calls for help in our town.
Well, it's wonderful that you guys are representing that group, and of course, we are representing the group of people who rely on you guys. And we want to thank you.
Yeah.
Well, and that's why we do it. And we all have different reasons for getting into this. Lots of it is just about helping out and being there because people call us at their worst times. I mean, we're going into your house when you've decided you really need help, and that's a tough time for the folks. So it's good to be there.
But it has to be a very emotional job, too. It must be difficult at times, right?
Well, you can keep your emotions in check. You got to sort of set those aside a little bit and compartmentalize those. Sure, there are times where things get ugly and hairy, but we're there to help, and we need to show that sort of strength when we're there. We can't walk in and fall apart. We have to be strong then, and later on we might fall apart.
Right, but at that time we're
on
a job to do,
we're a
right?
team, and that's we know what we need to do and get in and get out and get you to the hospital and get help.
It's amazing.
Just having them in this room creates such a feeling of trust and safety. It's just, you're wonderful people.
Sure. So many times they have people's lives in your hands, right? And it's an amazing responsibility.
We do.
So anybody you want to say hello to, Richard?
Well, the entire First Aid Squad. I mean, that's why we're here. We wouldn't be here without them and my family and friends.
Terrific. Listen, there's some breakfast I know you guys have been enjoying. It's the very least we can do. And Meridian has been so terrific, as always, to us. And they know the hard work that you guys do so much. So on behalf of them and on behalf of us, all we could say is thank you guys so much.
Well, thanks for helping us, too, and drawing attention to this, because we all need it.
Oh, yeah, you're the best.
And let's make sure it's not just a one-day thing, right? This is something that's 365 days a year.
Anytime you see someone, say thanks.
Absolutely. True heroes. And it's a pleasure to have you here and an honor to have you here. Thank you again. Stick around, because we're going to be talking more about it coming up a little bit later on. It's 8:15, 94.3 The Point. 94.3 The Point. It is 8:22, and we thank you for joining us. Of course, the spotlight this week, and especially today, as we're throwing a little bit of a party for our EMS heroes, and it's just been a wonderful day, and we thank Meridian so much for being part of it as well. And we are joined by a couple of very special guests, Dr. Ahamd and Dr. Roma. And guys, thank you for being here.
You're welcome. Thank you for having us.
Thank you, Lou. Dr. Ahamd, tell us what you do and how important EMS workers are to what you do.
Well, I am the medical director of Pediatric Emergency Department for the Meridian Healthcare System, and I oversee mostly Jersey Shore University Medical Center and Ocean Medical Center. And as far as the EMS and medics work go, I mean, they really are true heroes, and essentially almost always they are there at the front line in almost every situation, and they are saving lives on a daily basis.
It really is amazing work that they do. When you think about the wide variety of things that they could come across during the course of their day. And Dr. Roma, who's here with us, is an ER physician at Riverview Medical Center, and you know better than anybody that all the range of things that can happen, and those guys being out there is so critical.
Yeah, well, EMS is really our first link to being an ER doctor. They're the first people that really get the story, get the history, and basically they're volunteering to get these people to the hospital. So
that amazes me.
You really got to commend them that they're waking up at 3 o'clock in the morning,
and they have regular jobs and families and lives
and they come in and the people prior, we know them all on a first name basis, and a lot of times they're giving us the heads up before they even come into the emergency department. So especially like with stroke and thing, which is time is critical. It's very important, and we have a very good collaborative effort with the EMS.
It's funny, we've been talking about stroke a lot. It's been in the news the past couple of days. Let's spend a minute talking about that, some of the things people should watch out for, because I know a lot of people hesitate to call EMS because they feel like, oh, maybe it's nothing, maybe they'll get some sleep tonight. What do you say to people? What would your advice be?
It's better to err on caution. It really is to err on caution and basically activate EMS relatively quickly. Worst case scenario, you go home and we tell you it's okay. But we wind up wanting to know right away. Frequently, speech is off. Your face doesn't seem the right way. You may not even be aware of it. It's frequently the people that are talking to you that notice something. And we're seeing sometimes children that can save a grandparent or a parent because they know something's up and they've been educated.
Right.
A lot of times, especially more stoic elderly, will see there's a problem and they'll try to go to bed and maybe it'll go away. And that's really the worst case scenario, because then they wake up and if they've had a stroke, we're limited by time. We really try to get the quicker the better, and then at least we can evaluate and assess and see whether, hey, if there's anything that we can do.
I'd probably really also guess that there are some people that think, I don't feel good, but I think I can drive myself to the hospital, where they probably should call somebody to take them, right? EMS.
Oh, absolutely. Anytime you're in doubt, it's always better to pull over and call EMS. Or even at home, if you're in doubt, call them. And a lot of the times we get patients coming in the hospital. They had called EMS. They came and they said, "You're okay if you want to drive to the hospital yourself. You're okay to do so," and they come in. But at least they have assessed the situation and gave their clearance that you're really okay.
That's good to know. Yeah,
Dr. Ahamd, as a person who works in pediatric emergency, the medical director there at Ahamd and Children's Hospital at Jersey Shore University Medical Center and Ocean Medical Center, you know that those EMS workers not only have to deal with all that they have to deal with, but there's nothing scarier than having a child that's sick and parents that are frantic about it. They have a lot to deal with at that time.
Oh, absolutely. They walk in really not even knowing many times what the situation really is, and they kind of sometimes face a scenario where they may not be fully prepared ahead of time, and they have to really deal with that. And they do a great job. And as you said, in a case of a child, it's really, we always say, it's not just one patient. It's pretty much the whole family that you have to really satisfy, if you so to speak, or calm, keeping them calm and taking care of the child at the same time.
It's so nice of you guys to come, and I know how important the EMS workers are to you, and I know that's why you're here. Thank you for being part of the tribute today. Thank you to Meridian for doing such terrific work. Dr. Ahamd, nice to meet you.
Nice to meet you, too.
And Dr. Roma, the last time I called Dr. Roma, I wasn't calling him Dr. Roma. I was actually saying, Kevin! And I'll tell you why. Because we were jogging together. We were on a track team together in high school.
Wow.
It's been a long time, right?
That's a small
Just
world.
a few years ago.
We need a whole show to find out about Lou's high school days.
Unfortunately, we just happen to be out of time right now.
What a shame.
Well, guys, thank you so much.
Thank you so
Very
much.
good. Thank you very much. Nice to see you again.
All right, it is 8:27 at 94.3 The Point. And please, folks, remember those EMS workers and the heroic work that they do, and tell them thank you. It's 8:27. We'll get you updated with Monmouth and Ocean County news.